screen in case Dr. Gauri is here. Satpati ji, आप हैं हमारे साथ में? अगर आप हैं तो we're very very happy to have your camera on.
Yes, sir. I'm there.
Thank you so much, sir. Thank you so much. So this program started as a small dream when we were traveling together in an aircraft. So Satpati and we were talking what to do for the patient. We normally do things for the doctors. We do so many CMEs and conferences. So I spoke to Dr. Gauri Devi. So Gauri Devi had suggested me to do such a program where we can empower the patients. So it was an idea which ma'am and me were thinking from a long time, and then talked with Dr. Mr. Satpati. And this thing happened. So we started with something called Sanjeevani, and this was led from our side by Dr. Gauri and Shweta, and from Inta's side by Satpati and another Sanjeev and Manavji, who are always with us to make it a success. It has got two parts. One is called Sanjeevani, second is called Sandesh. So Sanjeevani meant that we gonna reach the clientele, patients, and educate them. So that's about reaching the patients. We thought we'll educate them, healthcare workers. Second was the part was called Sandesh. For Sandesh, we were educating the healthcare workers. You'll be quite amazed that 1,500 healthcare workers were trained. Just close your eyes and think about this number, guys. 1,500 healthcare workers were educated, trained under mentorship of Dr. Gauri Devi. She has been watching, and Sarabjit. इसके बिना तो हो नहीं सकता था. So both of you have done a great job. So Sarabjit, 15 chapters you covered. You covered 15 chapters, 12 languages, 30 camps, pan India, in around 8 months. Just think about it. Just think about it. 900 flip charts. And gentlemen, ladies, the most amazing part is what the team from Intas did. They recorded 60 videos. 60 videos in 12 different languages. So from Kannada, Malayalam, think about the language. They recorded the videos. They went to everybody's clinics. They recorded the videos, and then they made so many flip charts. And it was a big journey for all of us to mature. So thank you so much for this. And this is a program which we have in front of us now. And in this program, as you can see that the whole chapter secretaries who have participated, their names are there. Then we got the program for the day. And that's the way our journey came up. So this is what has been given to me: 15 state chapters, 30 camps, 12 languages, 1,500 healthcare workers have been educated. So I think amazing job done. And I think that's all from my side. I'd like to sign off from here, and I'd like to hand over the mic back to Yogita to invite Dr. Gauri Devi. Dr. Gauri Devi के बिना ये program हो नहीं सकता था. Madam was the person who initiated the program in my mind. She ideated it. And fortunately for me, she was my president when I was the secretary. She also executed it. So thank you so much, Gauri ma'am, for this. And with this, I move off and I hand over the mic to Yogita back to invite Dr. Gauri Devi. Thank you so much.
Thank you so much, sir. Let us now hear from Dr. M. Gauri Devi. She is convener, Patient Resource Committee and past president IFS. As Madam shares her valuable insights with us, she is the fundamental backbone of this program. Madam, we welcome you over here. Please say whatever you feel, your experience and your keep us motivated.
Thank you. Thank you, Dr. Yogita and Dr. Shweta and Dr. Pankaj for the kind words. As Dr. Pankaj told, this was a project Sanjivini in collaboration with Intas. What all Intas did for us, Dr. Pankaj has told, we are very much indebted to them. All those flip charts and things like that that they had made, and they really helped us to reach far into the to the chapter secretary, some places from where we could take the videos, get the things in place during the camps. It's a stupendous job, but they did it for us. As Dr. Pankaj said, it had two parts, Sanjeevani and Sandesh. And Sandesh means you are spreading the message. So for that, what we did was to have flip charts in the regional languages. So this was all done with the aim to outreach into the deep remote areas of the different states. The main tier 1 cities or the metro cities, there was no problem. But the thing is to outreach into them, so that we tried to take the help of CDMOs. We tried to contact the PHCs and CHCs, got hold of the CDMOs, and then the chapter secretaries and a team of workers approached them, and then we could spread it into into these remote areas. Now, to the ASHA workers, if we say in English or in Hindi in a South Indian state, it is difficult. So the thing was to get them all into the regional languages. And the chapter secretaries did a wonderful job getting it done in the regional languages. And I'm sure Dr. Sarabjit will show you the slides. I didn't want to keep on repeating whatever is being done. So the slides you can see, there are, in regional languages, in Telugu, in Tamil, in Bengali, we have got the slides so that it reaches. And main thing was these ASHA workers, it was, we were doing a follow-up, and they said it is really helpful for them. They were telling that they are able to make the patient understand what it is about the different things. Now, what was it that we were trying to do? All the details of different chapters, how many we did, Dr. Pankaj has told 15 states and so many camps we did. Our aim was for 2 years actually. We wanted to do over 300 camps, but with this MNC thing and all, Dr. Satpathy could not continue with it, so we had to wind it up this year. The topics we chose were menstrual hygiene, female infertility, PCOS, cervical cancer, breast cancer awareness, and fertility myths. As you all know, all these were very important topics, and this had to be conveyed right into the deeper into the villages, so that they have a lump in the breast, they don't come out with it, they don't tell anybody, but with these they'll come out and say, okay, I have got it, I should better go to a doctor, not to a quack. So this was our idea in spreading it. And successfully we could do it. About in about 30 camps we covered about a lot of health workers as well as patients. You will see the slides Dr. Sarabjit will show you, wherein the whole waiting hall is crowded with patients who wanted to listen to this, and in Hindi it was so good for them to understand things and then approach properly. Now, all this could not have been possible without the help of so many people. Our president, Dr. Pankaj Talwar, who actually had the seed in his mind. And when I was the president, he was the secretary. It was our aim to outreach. That was always my things. We had reached Manipur and Dimapur, where never there was a CME on infertility. That time we had reached. So that was always in our mind. And Dr. Pankaj took it to another level. And this could not have been possible without Dr. Pankaj Talwar, Dr. Shweta Mittal, who really supported us throughout. And the main backbone here is Dr. Sarabjit Singh. He could really coordinate well with all the chapter secretaries and the people. Sometimes we had to remind again and again. Sometimes we had to tell the people who work under Satpathy, please, the things have not reached. Tomorrow we have a camp, please send it. So he really did it well. And my special thanks to all the board of directors who really helped us and encouraged us to go ahead with this thing. INTAS for the financial support, as well as all the flip charts and the videos, etc., for which they helped. And I cannot but forget all people who worked under each chapter secretaries. There are really 6 or 7 people. All of them worked, took the trouble of making the videos and sending it to us. And thank you very much to all of you. And I'll hand it over to Sarabjit. Thank you.
Thank you, ma'am. Thank you so much. I now turn over the session to Dr. Sarabjit Singh, who is the coordinator of Sanjeevini program, to share his valuable experiences with us. He actually made every effort to ensure the success of this program. Sir.
Yogita, before you just hand over with permission of Dr. Gauri and Shweta, I'd like to speak something about Sarabjit Singh.
Yeah, sure, sir.
I think what you did was magical, Sarabjit. Coordinating so many people. Actually, I have tears in my eyes, so they have no value in today's world, but I have tears in my eyes. I know what you have been through, what you have done with the whole team members. It wasn't easy. And the best part was that you made it look so effortless. I mean, difficult to get a person like you who was working and now with Yogita as your friend. So, Sarabjit, you worked the way you worked, you never showed that you were under stress and you worked around the clock. 30 camps. Gauri ma'am, 30 camps
Yeah,
in 6, 7 months,
really.
more than 13, 14 languages, 60 video recordings. I remember the way this guy was chasing, and Sanjeev, in case he's there from Intas, we three were chasing, and Dr. Sajjad Hussain was so angry. चीजें नहीं मिल रही थी. Talking to the blue dart people, talking to the people at the lowest level, at the last minute, all over the country to get that booklet should go reach the CMO. I think what you did is unparalleled, and I'd like to thank you as an elder brother for what you've done for me. Thank you so much, sir. Over to you now. Thank you.
Thank you, sir. At the outset, it was not difficult because I had, super coverage from you, sir, from Shweta ma'am, and from Dr. Gauri ma'am. So every difficulty that was coming over there was actually an easy part to do because I was mentored by you people. So thank you very much for trusting me to carry on this program. Uh, Dr. Rashmi, Madam, and Dr. Shalini, I could not say thanks in the earlier part, but both of them actually were very quick to, understand what the program was, and then everything to collect these videos and then put it on various platforms of IFS. They again did a very wonderful job, along with the INTAS people, Satpati ji, then there is Sanjeev, and there are a lot of other people who are involved in creatives and shooting those videos, editing those videos, putting it in different languages. If you ask me about the problems, yes, there were a lot of problems. The main issue was we were dealing with different languages. So sitting at daily and editing those languages is not easy because I don't know anything about the Kannada, Malayalam, or Andhra Pradesh. So even a single sentence, even if you're trying to use the AI, then you come to learn that there are so many problems with the AI. Medical terms are very different from the normal terms. So there were difficulties. Then already we have spoken about, Sajjad sir. Believe me, सुबह को उन्होंने अपना कैंप शुरू किया एंड I suppose the last message I got from Mr. Sajjad was at 8 p.m. They still were carrying on with the cancer. There were a lot of people. Then again with the Tamil chapter, I remember there were electricity issues. The electricity was not there. They could not record it. There were fans, and क्या कहते हो, the the network was not there. A lot of all those issues. And even the smaller that we are sitting over here and we ask if you want a pizza, they can come over there and deliver over to your place. This was not even something like a simple samosa to those places. So these all were carried from different places. But then the most importantly, and a huge thanks, and I should say that viewers should cheer about the chapter secretaries, and they all did a very wonderful job. And we would like to continue with them, and hopefully, some sort of finances would be ultimately solved with these companies, the MNCs. But it's a wonderful program, and I hope and it should continue. I believe that also, and with the mentorship of Dr. Pankaj and Dr. Gauri ma'am, and they must be putting a lot of effort to continue it in their own ways. And I would like to join in this program once again and carry out the remaining part of this program. Thank you very much.
So thank you, Sarabjit. Thank you so much. So Yogita, as you said, let me have the honor of inviting our past presidents. So all of you who are not aware, or some of you are aware, uh, IFS is governed by a board of directors. All the past presidents are part of our board of directors group. So they'll all be joining in some minutes. They're all working. I can see Dr. Kuldeep Jain, sir. Kuldeep Jain, sir, you are there. Kuldeep, sir, is here on the screen. I will just put sir in the speaker's view. Sir, we can't see you.
हेलो
हाँ जी सर, आपको सुन पा रहे हैं, देख नहीं पा रहे हैं। बट कुलदीप जैन के बारे में इतना बताना चाहूंगा, एवरीवन नोज अबाउट हिम. Sir is the founder, secretary of Indian Fertility Society. Sir has been the past president of IFS. Sir is the chair of the International Exchange Committee for IFS, and he's really put IFS into the map of the world. He is the founder of ASHRAE IFS Embryology Training Course, and he's got so many collaborations, so many books he has written. I think he is mentor to all of us. Kuldeep sir, it's a great honor to, in few words, to invite you to speak something about this project. I've spoken to you about this around a year back, and now gradually we are able to present to our board of directors. Dr. Gauri is also part of our board of directors. So we present this work to you today, sir. We'd like to hear from you.
thank you Dr. Pankaj. It is a program, any program actually, I always feel very high when it is adding to the glory of Indian Fertility Society. So as far as this program is concerned, I am seeing that a lot of effort has gone into this program, and this is continuing with a vision which we saw when we started Indian Fertility Society. So I really congratulate your team as well as Dr. Gauri for spearheading this wonderful program. Certainly, at the end of it, if we are able to reach to the masses, because when we started in 2005, the one of the vision was that whatever we are doing or we are learning, it should go to the root, and finally the patient should get benefited. So any program which is contributing to the vision, original vision, is always welcome, and you have really done phenomenal homework how to reach to the health workers and uh, train them so they can further continue with the patient counseling and all that. So I feel really elated when this type of work is being presented anywhere. As a founder secretary, uh, I see it as another milestone in the history of Indian Fertility Society. I must congratulate whole team uh, for doing this wonderful job. And here we can see the teamwork, and that is what is required. So congratulations to all of you.
Thank you very much, sir. Your words are always motivating us, and I mean, you know it. We can't thank you more than this. You've been a great support to all of us. So, Gauri ma'am, with your permission, and Shweta, with your permission, now I think we should hand the mic back to Yogita. Yogita, now you can take on
Sir,
and
yes,
invite
yes,
everyone
yes.
one by one. And
Yes, yes.
I think before
Sir,
we move on,
first, yeah.
everyone has been, you guys have been phenomenal, all of you. And my calls to you were always at 4 o'clock in the morning, 4 o'clock, 4:35. I have the time I to speak to you. And you guys have done a wonderful job. Thank you so much, everyone. Over to you now to present your work. Yogita, all
Yes, sir.
yours.
Sir, 1 minute, sir. Let's give a warm welcome to Mr. Satpathy also from Intas Pharma as he shares his
Yes.
perspective on corporate social responsibility. Mr. Satpathy.
Satpathy sir, you are there? Satpathy sir.
Yeah, I'm there.
आप तो सुनना है क्या क्या हुआ इसके पीछे क्या क्या हुआ आप बताएं.
No, thank you so much, sir. And I think it was one of the dream project of you and me. And I feel this was a small way of giving back to the society. First of all, let me correct all of you that we have not yet called it an end. This is just a temporary setback for which we have put a pause. So I'm not telling that we are not going to continue this program in future, because with this new NMC guideline coming in, I do not have a problem in creating those creatives or making those videos. Or see what happens when I make an individual video for a social cause, that is allowed. But when I make a video to promote any doctor, that's not allowed. The only challenge which we are facing is arranging the endpoint arrangements, like arranging those snacks or a LCD projector at that point. I do not have a registered vendor who can do this. And what we were doing is we were managing those expenses we give some amount to our team members, which is called as out-of-pocket expenses, like somewhere they need to take a taxi or something for that they use. So they have been using that money for conducting those programs. But unfortunately, when they submitted their claims, our audit department says that you have utilized this for something else, which looks like a social gathering or something, and you were not given money to spend on this, so the money is stuck. So my apologies for that. We had to stop it abruptly because almost 20 lakhs worth bill got accumulated at my audit place, and this is actually the money I have to pay to my team members. This is what they have spent from their pocket. So I have been fighting with my CRM department, the audit department, and the finance. I'm sure I'll find a way out. Pankaj sir, don't get disheartened. This is a program we have started with a very big ambition, and we will continue this program. But apologies for this 3-4 months for which we could not continue this. Other than that, I know it was challenging creating so much of creative things, like whether printing 6 different topics in 6 different languages and all those things. I know I would like to thank my team for that extra effort, other than their regular work, which they've taken to really deliver things in time. Shooting those videos, I would like to thank our in-house studio who took that initiative of doing that. But sir, I think, trust me, I'll find out a way, and we would complete that 300 dream number, which we thought of while beginning the program.
Thank you so much, sir. Thank you so much. And Sapati ji, please thank your team from our side. I think जब पहली बार मैंने देखा भोजपुरी, कन्नड़, तेलुगु, हम समझ गए कि कौन सी भाषा क्या चल रही है. Dr. Gauri and Shweta was trying to scan the documents, and they were all alien for us, not only in listening but in reading and speaking. This could have happened without you, sir. And लाइफ में चलता रहता है अप्स एंड डाउन्स, बट हमने मिलकर बहुत अच्छा काम किया अंडर योर विद योर हेल्प, एंड वी आर ग्रेटफुल टू यू. हम आगे कहाँ बढ़ पाते हैं इट्स ओके, बट वी हैव डन ए ग्रेट जॉब टुगेदर, एंड आई थिंक इट्स गोना चेंज सो मेनी लाइव्स. धन्यवाद. थैंक यू इन ऑल द लैंग्वेजेस आई कांट स्पीक.
No, sir, you don't have to thank me. It was a small gesture how we can pay back to the society, and we have done it together. We do conferences where we spend crores, and a few lakhs goes in these activities. I would feel like I have done something good for the organization, for a society like IFS, and for myself. So
thank you.
Nobody has to thank anyone, but yes, Sarabjit sir, the amount of effort, Gauri madam, I have seen that, and Sanjeev used to come office at 9:30 and sir, पता है कल सुबह 5:30 बजे फोन आया था पंकज सर का. Well, you start getting up early now. He's an army man.
कहते हैं ना कि अभी बोलो कि अगर सतपति जी हैं तो मुमकिन है, सब मुमकिन है. चलेंगे, आगे बढ़ेंगे. But thank you, sir. धन्यवाद.
Thank you so much.
And to your whole team. Gratitude to your whole team.
Thank you.
Yogita, over to you.
Thank you. Without further ado, let's start with the presentations today. So I'll be sharing my screen.
So,
So is this visible? The screen is visible?
Yes,
yes, it's
Yes,
visible.
yes, we can see
Yes,
that.
yes, yes.
it's visible.
Okay, Himanshu is there. Please allow Dr. Syed Sajid, unmute him. So as we all know that this program was conducted in 3 phases. So we will be starting with the phase 1, in which Kashmir chapter will be presenting first. Dr. Syed Sajid, chapter secretary, Kashmir. Sir, are you there?
Yeah, I'm here, but
Sir,
my video is
yeah.
not coming.
Himanshu,
Yeah, now.
please.
Yeah.
Yeah.
Good afternoon,
Yeah.
everybody. Am I visible?
Yes,
Yes,
we
sir,
can
yes,
see
sir.
you, we can hear you. Doctor.
Yeah, I will keep that now the light is behind me off. Yeah, I'm visible now. Yeah. Yeah, good evening, everybody. My sincere thanks and gratitude to our worthy president, Dr. Pankaj Talwar sir, our secretary ma'am, Dr. Shweta ma'am, Gauri Devi ma'am, and Dr. Sarabjit for formulating and conducting this beautiful and program of Sanjivini in far-flung areas. That was a best thing there because, but here, if I will take the example of our state, J&K state or Kashmir, it was very difficult to conduct such a program in government sector because in for government sector, what we have to do, we have to first of all get the permission from the government authority, that is Secretary Commissioner Secretary Health Services. Then after we have to take the permission from our regional director, that is the provincial director Health Services Kashmir. Then after we have to take the permission from the that district, means chief medical officer that area. After that, we have to take the permission from the block medical officer of that the PSC where the it remains that in which block it will be. So we have to take the permission from that block, and at the end we have to take the permission from the concerned senior medical officer or the in charge medical superintendent of that PSC. But we have done all those things. We have taken the proper permission from the government, from the Commissioner Secretary Health Services, then Director Health Services, and all others. And we conducted these two beautiful and especially participation was beautifully there. Everybody came from far-flung areas. First camp we held at Kunzar, ASC Kunzar, which is in it's a far-flung area. It is in district Baramulla, Tehsil Tangmarg, and it is just near to Gulmarg. So it was the World of IVF Day. On that day, we had held the first camp. There were 150 workers were 150 health workers were there. 93 infertility patients we saw, as Dr. Sarabjit had already told it, that the camps were held just up to 8 p.m. because after the camp, after all the activities, what we done, we have seen the patients one by one, but it was just up to some 8:30 or 8. We could not even have we could not even get the lunch. We had just the snacks, we had just tea, but we have done all those things. Inauguration was on that, but in the first camp, it was inaugurated by the senior IS officer, Dr. Farooq Shah, and this time he's now the legislative assembly member. The campus where in the first camp the books were released, those charts were released. Flip charts of Sanjivini were released in the first camp, and that were being sent by INTAS. We are very thankful to INTAS people also. They have sent us on right time those English version. Only for the Urdu version there was some delay, but not for the English version. So it was held very beautifully. The gift wrapped clocks were also given to the those health workers, and the health workers were educated there. There were more than 150 health workers who were that now have been educated there with these flip charts. And then second camp.
But I'm running the first video.
Yeah. Yeah, it is the first CD. Yeah, you can have this, but there is no voice. Yeah, she was the chief medical officer of that district was present. I had given this Sanjivini that book to chief medical officer of that district. You can see the hall was jam-packed. Even the people were outside waiting. These were only the health workers. The patients were in the PSC. After the camp, we had held the OPD. Though he was the senior IAS officer, Mr. Farooq Shah. Now he's an assembly member. She's the chief medical officer of that district. Though there were so many electronic media as well as the press media who were there, because it was a big show from Indian Fertility Society. I think for the first time in our Kashmir division that such camps have been held by a non-government organization in the government or setup. It was a beautifully, because till date some few meetings, small meetings have been held in by Foxy in LD Laldet, government Laldet hospital, but not in the peripheries. This was the first event by Indian Fertility Societies which was held in the periphery. So then after we had the second Sanjivini camp at Community Health Center Hajin, which is again a far-flung area. It is from the district of district Bandipora, which is we can say it is an LOC, line of control from our state, our country to another country. This is a line of control. So at that place we had this camp, second Sanjivini camp at CHC Hajin, Tehsil Sumbal and district Bandipora. It was held on 10th of August 2022. So in 2024, sorry. So in this camp there were 250 health workers present, and 230 patients were being seen by the IFS team, including 170 infertile couples. Inauguration was done by at 1:30 p.m. and the inauguration ex officio secretary to government and director Sikkims was present, as we are having the director Amos in same way we are having here director Sikkims SK Institute of Medical Sciences. So he was present in that camp, including other dignitaries. There were senior KS officer and additional director Sikkims, director health district health officer Bandipora, additional joint secretary, and BMO Hajin and other dignitaries. So that camp we had again given the some colloques to the some officials from the INTAS, and videos were released there, and there were paramedical staff of the paramedical staff our center from Madej. They have noted down the case histories. Those case histories was already lying with me. There are, I think, more some. It's a big envelope with me where we are having the those case histories of those patients which we have already seen in the both the camps. So at any time whenever I will be at Delhi, I will now get those with me. So this is the director of health, director Sikkims, medical superintendent Sikkims. So I think again it was a good pride that we had a second camp at again government CHC Community Health Center, including the participation was from the government side also, Director Sikkims as well as the senior case officer and additional joint director who is himself a doctor, Dr. Farooq Giri. And we at that time again we have given those books to and flip charts to the concerned healthcare workers. So that was a blessing. So you can see again the hall was full of the healthcare workers. These are not the patients. We had seen after this camp. These are all the health workers who have joined from all over district. This was the Bandipora district. Here, all the healthcare workers came from Bandipora district. Last time they came from the Baramulla district. And you cannot believe the patients were from so many places. They had come just by foot for 4 kilometers, 5 kilometers from the hilly areas just to see the doctors from the Indian Fertility Society. So it was a very successful, I can say both the campus were very successful campus, and APITUS type, these were the first campus held in Kashmir by Indian Fertility Society or a non-government organization in the government organization, and was the help. There was a full support from the government side. That was a good thing of these campus. So this is the video. This is our direct ex-officio sector to government and director Sikkims. So again, here there were the media persons from the electronic as well as the newspapers. People had come, and it was all over state. It was shown on TV, televisions, as well as the social media. So for these campus, what we have done for the remotest areas, we have to use our transport. So for all the doctors and the paramedical staff as well as other supportive staff, we have used that expenses from our own pockets. INTAS people have supported us very well, but there were some banners which we have to made of our own. These banners were made by us from our own pockets. Our own doctors have supported this activity, even from the government side as well as the private side. You can see that there was a huge rush of patients, which we have seen till 8:30. So we left that CHC Community Health Center there on that second camp. We could not have the patients in the inside the hospital PSC. So we have fixed a tent, big tent there. So there the case histories were being taken by the paramedical staff of the MedAge IVF Center. So after that case history, they were sent one by one to the IFS doctors team, and they have taken the consultation from the IFS doctors team in the PSC. So after that, you can see in both the campus, after we have held the Keys campus, the coverage was all over India, all over J&K. Even if it was in national newspapers as well as national these social network sites. So it is all over. IFS launches SANJIVINI, uplifting women's reproductive. You can see there are IFS conductors uplifting of women's reproductive health. So the message was all over our state as well as all over India. So IFS conducts uplifting movement of the reproductive health. IFS launches SANJIVINI for uplifting. So it was in these campuses which were held. These were appreciated by everybody from the government side as well as the public. People were very glad for this. So we are now we are having the people are telling us, other block medical officers, are you having some plans for other campus in our state, in our places? So at that time we are telling them we will see, we have to discuss with the central team, then we will see. But the previous campus, they were the big success. So thank you very much.
Thank you, sir. Congratulations, sir, for conducting the camp so wonderfully. Now I invite Dr. Nitasha Gupta. She'll be presenting on behalf of Dr. Seema Mittal from Haryana chapter.
Thank you, Yogita ma'am.
Unmute Dr. Nitasha.
Yeah, thank you, Yogita ma'am. Am I audible?
Yes, yes.
Okay, I would like to thank Dr. Pankaj Talwar sir, Dr. Shweta Mittal ma'am, Dr. Gauri ma'am, Sarabjit sir, and also the whole team of INTAS, Satpati sir, to make this possible and make us a team for the patient empowerment program. Ma'am, can we have the next slide? Okay, so on 25th July, as we were celebrating the World IVF Day, the first camp under Sanjeevani was organized in the Anganwadi Center, village Hansala, Rewari in Haryana. And it was under the leadership of our chapter secretary, Dr. Seema Mittal ma'am. And ma'am, can we have the videos now? I'll walk through the... Can we play the video? Okay. The camp was a big hit because it was attended by the health authorities, Dr. Poonam Jain ma'am, Dr. Abhilasha Jain, Dr. Madhavi, and they were the supervisors of Anganwadis, Mrs. Seema, Miss Sonam, Mr. Ritesh, and Mr. Manjeet, and Mr. Hari Prakash, who were actively taking part into the management of these camps as well. We trained around 25 Anganwadi workers and the helpers, and there were 20 village females to help us. So there were the number of patients seen in the camp was 17, and there were total 65 beneficiaries. So the common findings which we saw were that there was stress of being called banj, which was shared by some of the patients. Financial problems were there. There was lack of awareness and inhibition in sharing their problems. The second part which we can see was done on 10th of August 2024 under the leadership of Dr. Neeru Thakral ma'am. The camp location was UPHC in Rajiv Nagar near Sector 12 Chong. It was also the other team members, Dr. Reema Goyal, Dr. Divya Sardana, Dr. Priya Varshne, Dr. Saroj Kumar, and Dr. Alga Goyal actively participated in the camp. It was also attended by Dr. Priya Sharma, who was Deputy CMO Gurgaon, and Dr. Hardeep Saluja, who was in charge of the UPHC. There were training of 38 ASHA workers and 42 patients attended the camp. There were total 80 beneficiaries. And the common findings also seen were the ignorance about the treatments and the test, emotional and health issues, stress of being called by ban was only shared by some, financial issues, and family pressure. So the reportings of the first and the second camp was very well done by the media, and it had a newspaper coverage. So the observational inputs were, it's very important for the spreading awareness by reaching out via camps. It seems important that there are myths and religious belief related to infertility, and it remains a social stigma. Infertility-related health camps should be frequently organized so that the local doctors can counsel them, and the couples needing treatment can reach the infertility units at right time. We should also hold these camps in every district of the state and appoint a leader from that district. All the GPs and health facilities should be intimated well in advance about these camps for a greater patient footfall, and the target population should be sought even in the interiors of the areas by the local workers for the awareness on a larger scale. So to sum it up, success is the sum of small efforts of many hands. Thank you.
Thank you, Dr. Nitasha. I now invite Dr. Hitendra Somani from Gujarat chapter. Himanshu, please unmute Dr. Hitendra Somani.
Good afternoon. Greetings from Gujarat. I'm Dr. Hitendra Somani, Chapter Secretary, Gujarat. Project Sanjivini, a dream project. लोगों के साथ, लोगों के द्वारा, लोगों के लिए, लोगों की भाषा में और उन्हीं के घर के पास किया गया हुआ एक ड्रीम प्रोजेक्ट of our President, Professor Dr. Pankaj Talwar sir, Dr. Shweta Mittal madam, materialized by Dr. Gauri Devi and mentored by Dr. Sarabjit Singh, or supported by Satpathy sir from INTAS, Sanjeev Bhai, and entire INTAS state. It was a unique project. You may please play the video. This unique camp was organized in a small town called Faryadka, which was far away from Bhavnagar district, a very small village with very limited facilities. It was organized in association with government machinery. The CDHO, Dr. Chandramani sir, RCHO, Dr. Kokila Solanki, and district health officers, myself, my colleagues, we all took part in a camp. It was very much attended by so many ASHA workers, more than 22 ASHA workers, village health supporters, 4. Then 9 of the staff nurses were trained, medical officers were trained, and more than 27 infertility patients were seen, and they were given advice about the infertility. This camp lasted for more than 6 hours, and it was well organized in such a way that every patient received information in local Gujarati language. They were explained, see this leaflet. With this flip chart, they were explained everything in detail. They were taught about infertility myths. They were taught about menstrual hygiene. They were taught about how to do self-breast examination, cancer awareness. Every part of female reproductive system was explained to them. And this was organized by keeping the local authorities like Sarpanch, तलाटी, इन सब लोग को, गांव के सब लोगों को साथ में लेके किया, and it was very successful. This was phase 1 program which was organized at Fariyatka town of Bhavnagar district, Gujarat. And this, at the end of the program, we delivered a toolkit to all the healthcare workers so that they can also teach to more patients. And special toolkit which was supplied by our president, sir, was given to ART authority of the district, that that was explaining about the ART law and how its implementation and new ART rules. And this was the first phase of our camp. The second phase of the camp was conducted by my dear friend and joint secretary, Dr. Sanjay Desai, in the Rajkot district, a small town. He also did an excellent job by getting all the healthcare workers together. And there also government CDHO, Dr. P.K. Singh, Pankaj Sharma, Dr. Sanjay Desai, Dr. Hemali Karya, and all the health workers, they attended the program. 26 healthcare workers were educated. So many doctors were taught. 42 patients were seen. They were given detailed information. The inauguration was done. Toolkits were distributed. Patients were given snacks, and they were explained everything in detail. Additionally, we also provided a facility of PEP smear in both the camps so that we could give them more and more informations. All the patients were explained in detail. Healthcare workers were educated about what are the alarming signs, when to refer a patients, when to treat them, when to counsel them. Especially young school-going daughters were taught about how to maintain menstrual hygiene. So in this way, we saw many patients and we explained them everything in detail. And at the end, small mementos which were provided by the center were given to the authorities. So observational inputs were that it's a novel project with unique idea to reach a very doorstep of the village people. And it was very successful because we involved Sarpanch, Talati, PHC subcenter staff, and government doctors. Lots of myths related to infertility were discussed. But lesson learned was that one-to-one interaction was very successful. Frequent organizations of such camps will definitely help. Next slide, please. So we need to win confidence of infertile couple by a lot of counseling, and need to do this work in collaboration with village health worker to convince them for infertility treatment. Health education with flip charts and audiovisual, especially in local language, was very, very useful. In fact, it was a game changer move. And need to do more advertisement of the camp so that more and more couples can get benefit. And finally, by close follow-up of those patients seen during camp who needed an advanced treatment and providing them at a very reasonable price was done, because we believe that if one couple from a village becomes pregnant, then 10 more couple will come forward for the treatment. Thank you, IFS. Thank you, Dr. Pankaj sir. Thank you, Dr. Shweta Mittal madam. Thank you, Isar. And my last thanks to my team, Dr. Sanjay Desai, Dr. Jayesh Amin, Dr. Nisarg Daria, Dr. Chwal Bankar, Dr. Partha Bhavishi, and Dr. Kokila Desai for being helpful at every stage of our efforts. Thank you. Thank you very much.
Thank you, sir. Thank you so much. I now invite Dr. Kalpana from Bihar chapter. Madam, are you there? Himanshu, please unmute Dr. Kalpana Singh.
Ma'am is not here, ma'am.
Ma'am is not here. I think we can move on to Vidarbha chapter. Dr. Bindu is there?
Yes.
Hello, I'm there.
Yes, ma'am. So Dr. Bindu, chapter secretary Vidarbha, madam, please.
Yeah, so good afternoon, everyone. And what can I say? I mean, for any strong building to stand up, there has to be a strong foundation. And for a nation to stand tall, the villages have to be strong. And I'm really glad that we have a strong foundation in the form of our IFS president, Dr. Pankaj Talwar sir, our mentor, Dr. Gauri Devi ma'am, Secretary Dr. Shweta Mittal, and of course, Dr. Sarabjit Singh, who have been such strong pillars to guide us through this program to empower our patients. So, such a wonderful concept of patient empowerment program. So, to go to the grassroots level to empower the patients and tell them that we are there, because health is wealth after all, and we have a huge population living in rural areas, and to reach them and to make them aware of their health facilities available to them is a huge task. And through this Sanjivini program, we have been able to do that. And under IFS Vidarbha chapter, we held 2 camps, the inaugural one on the 25th of July, and later again in August, on the 9th of August. And it was a wonderful program. I had the support of my members, my secretary, joint secretary, Dr. Manish Baheti, Dr. Sadhna Deshmukh Madam, Dr. Indrayani Hatwar, Dr. Amok Chimote. And let me tell you, it was a huge response from the healthcare workers there. They were also interested, apart from the patients who had come there. The healthcare workers were very keen to know what all we all had to offer, and the guidelines, the kind of the flip charts and all that we gave them in local languages. They were really impressed, and a very good response coming from all the healthcare workers also. The only point is probably if we had had enough time to let them know, because see, in these health centers, it is not the infertile patients that come. So we had a huge number of patients coming there at the camp, about 80 in one and about 120 in the other one. But the number of patients related to infertility were less. So of course, the flip charts were very useful for all the patients. But then as far as infertility is concerned, maybe we can plan it out better in the future, so that we have such patients also for our referrals later on. So many thanks to INTAS for sponsoring such a conscious event where we are becoming more conscious towards society. So many thanks to Mr. Satpathy and again Mr. Sarabjit once again for putting up with a grand show. It's not a mean task to do such a thing at such a level. Thank you so much for the opportunity once again.
Thank you so much, ma'am. I now invite Dr. Priya Kanan, Secretary Tamil Nadu chapter. Dr. Priya, are you there?
Yes, I'm here. Good evening, everyone. At the outset, I would like to thank for this opportunity. Though it was, we didn't know, we didn't have a precursor. It was quite very nice to go through this program. Our first program was done on 25/7/24 at Sathiram and Alangaim district. I was hoping to go there because I thought it would be somewhere around 3 hours from Chennai. But this was like about 5 hours from Chennai, which was like the interior. The Surya Prakash, who's the admin, the representative of INTAS, even found it difficult to find some place to buy food for everyone, but he beautifully arranged it. Dr. Sumita Lakshmi was the coordinator, and we had the PEP done in all the in the place. And these are some of the pictures with the CMO of the district coming in to inaugurate the program. And Dr. Samita Lakshmi was able to train about 15 to 17 health workers there. She was also able to do pap smears and ultrasound, apart from giving infertility counseling for the patients. And the video was shown, the prepared video was shown to all the health workers and the patients as well. It had about 150 beneficiaries in the camp with 25 trained health workers, pap smears, scans, free lunches, and tea to everyone. about 5 patients needed IVF and 10 for IUI. It was very nice. And the second program was done in Salem in a UPHC and coordinated by Dr. Anureka, who is also a member of the executive committee of IFS TN. It was done on 10/8/2024. Can we have the next slide? Yes, that is Dr. Anureka. And here also we had quite a number of attendants with the CMO of the district also coming in. There also some of the pictures and the attendees in the camp. She is she is a government servant, so I guess she was so thorough in her paper that she got a signature of all the attendees and the health workers. The 83 was the number of patients who attended, with 48 cases of infertility and 12 were cases with more than 35 years for cancer awareness. And she gave a report that the way to go for the society was that the infertility treatment was not a luxury but an essential commodity in all strata of the society. We think it is the problem of the affluent. It is not. It does not spare anyone. So that is what was her take home from this camp. And I thank all of you, particularly Professor Pankaj Selva sir and Shweta, for giving us this opportunity, for Sarapreet for coordinating everything, and also INTAS for giving us the opportunity. I would like to mention their representative here, Surya Prakash, who was on the ground doing everything. And I would also like to thank my team members, the EC members who did the cancer awareness leaflet and also the translation of it into Tamil beautifully. Thank you so much for this opportunity.
Thank you, ma'am. Thank you so much. Now moving on to phase 2. IFS Jammu chapter to be presented by Dr. Jeetu Mahajan, but she could not make herself available today because of some emergency. So now we move on to Punjab chapter. Dr. Surjeet Kaur, ma'am, Secretary
Hello.
Punjab chapter. Ma'am, are you there? Yes.
Yes. Should I start?
Yes, ma'am.
Respected Dr. Pankaj Talwar sir, Dr. Shweta madam, Dr. Gauri Devi, Sarabjit, and all the viewers of this virtual platform, a very good evening to all of you. Punjab chapter of IFS organized camps in rural areas in government CHC under the SANJIVINI Patient Empowerment Program in the second phase under the able guidance of Dr. Pankaj Talwar sir. On 28th August 2024, camp was organized at CHC Kartarpur. There are 35 ASHA workers, nearly 10 patients, and other doctors of that hospital. They all attended the program. The camp was organized with the help of the SMO there, Dr. Kiran Kaushal. And on 10th of September, the second camp was organized at CHC PAP Jalandhar with the help of Dr. Anamika Lal, SMO there. There 46 ASHA workers came, and the doctors of the hospital and other patients also attended the camp. In both the camps, the recorded videos were shown that were in the Punjabi, in the local language, and lectures were given all about the CA breast, CA service, menstrual hygiene, myths in infertility, and PCO, and all was well explained to the health workers and to the patients and other doctors also. Flip cards were also distributed, and flip cards were taken with great interest by the ASHA workers. ASHA workers took great interest in listening to all the problems, and it was a quite educative for them. And they had many queries also, so they were cleared in the camp. So personally, we had very pleasant experience of conveying this knowledge of serious problems to ASHA workers who goes door to door to catch the woman. I hope this type of camps under the able guidance of Dr. Pankaj Talwar, Dr. Shweta, Dr. Gauri, take our society to great heights. We would like to have such more camps to go in the rural areas, in the remote areas, to educate the health workers and the people over there. Educating the health workers who will extend their knowledge of serious health problems and their early diagnosis and treatment can save many, many people. This is a wonderful program to go into the remote areas and help the people. So this is a great service to the humanity. In the end, I am thankful to my colleagues, Dr. Sarabjit, Dr. Sukriti, Dr. Mandeep, Dr. Nidhi, and all my dear friends who helped me in making the videos. And I am thankful to Intas Pharma Company for sponsoring this event. Thank you.
Thank you, ma'am. Thank you so much. Next, I invite Dr. S.M. Rahman, Chapter Secretary, West Bengal.
Good
Sir,
afternoon.
are you there?
Yeah, yes, Yogita, you can hear me?
Yeah. Yes, sir.
Yeah, I'm starting. Good afternoon, everyone. First of all, I'll thank Sir Dr. Pankaj Talwar, Ma'am Dr. Shweta Gupta, Dr. Gauri Ma'am, Dr. Sharappreet for such a nice initiative. I think IFS was the first fertility society, I should say, who took this kind of initiative to reach the mass in the rural India, which was more important part. So we went into rural Bengal. We had our materials in local language, that is Bengali. We spoke to them in their language, and we talked to mostly the health workers who are the basic level health workers in villages, the ANMs, the ASHA workers, and of course we consulted, some patients also consulted us in that camps. So first of these camps were in Amtala Rural Hospital on 28th of August 2024. Myself, Dr. S.M. Rahman, Dr. Pragyanika Gurung attended this camp, and we got tremendous help from Dr. Arnab Pramanik, superintendent of the hospital. Around 20-25 healthcare workers were there, and the 15 patients also came for consultation. Among the healthcare workers also, some became patients. They had their own problems. They asked us about their problems. We discussed with them about, of course, awareness in breast cancer, cervical cancer, PCOD, infertility, and pelvic inflammatory diseases. And although next camp, that is, we did it on 23rd of September in Muchisha, BPHC, that is again a rural healthcare center in Bengal. And also the topic of discussion are basics of infertility, cervical cancer, breast cancer, menstrual hygiene, and PCOS. And also we had our materials over there. We distributed the flip cards and the charts and the diagrams all in local language, that is Bengali. And in this second camp, we got almost 25-30 odd healthcare workers. And also some of them had their own problems. They also talked to us about their relatives' problems, about a kind of consultation with them. In both these camps, me and Pragyanika communicated with them at length about the basic knowledge. Of course, we conveyed our knowledges in their language, Bengali, so they understood. They asked questions about all these, about that. What I understood during these camps, that in rural areas, people have a lot of actually lack of knowledge or lack of conscious awareness about these problems. That in a country like us, where if you can prevent PID through menstrual hygiene, we can prevent a lot of tubal blocks and lots of tubal factor infertility. So, or PCOD also. If you create awareness, we can prevent a lot of polycystic ovarian syndrome. So from my side, the take on this program, it was a very nice initiative where we could talk to them directly and they could talk to us directly. And I think we should arrange this kind of programs more in future into some rural health centers or rural parts of Bengal more often, so that they have awareness about infertility, also IVF, the indications when they need IVF, what are the pros and cons of IVF, what are the success rate of IVF, because a lot of people, the general people, doesn't have awareness about this. And I think as fertility specialists, it's our responsibility not only to treat them, also to create awareness. So I'd again like to thank IFS for such a nice initiative under the able leadership of Dr. Pankaj Talwar and Dr. Shweta Gupta ma'am, and other people who did this. Also, I'll thank INTAS people also for such a nice initiative. I would like to see such more camps in future. Thank you, everyone. Thanks from West Bengal chapter.
Thank you so much, sir. Now I invite Dr. Anjali Patil, ma'am, Secretary, Western Maharashtra chapter.
Good evening, everybody.
Madam is there?
Yeah, I'm there. Can you hear me?
Yes, ma'am. Yes, ma'am. You're audible.
So can you put on the... On behalf of Western Maharashtra chapter, I'm happy to see everybody joining here. And I've been really very thankful to Dr. Pankaj Talwar sir and Shweta Mittal madam, Gauri Devi, and our Dr. Sarabjit Singh, who have helped us to do all these videos. We did the first video at CHC, that is Koregaon, on 28/8/2024. And this is the video how all of my colleagues of IFS members, though I wasn't well, they all really shouldered this responsibility and they did a very good camp. And I'm really thankful to all my colleagues who really helped hard to have the videos of cancer awareness of cervix, of the breast cancer awareness and screening programs, and also about the this thing, menstrual hygiene, and about the fertility myths and PCOS. I'm really thankful to Dr. Alpana Vatve, Reshma, Vrunda, Smita, and myself because we made these videos. It was really difficult, but we could make it. And this is the first camp which we did at Koregaon. And we are thankful to Dr. Arundhati Kadam, who is a medical superintendent there. And she could help us to have the many patients over there, and we really did a good job over there. And this is the second video of the camp. We did it at Godoli PSC on 13/9/2024. And you can see such a huge response. Dr. Rasika Gokhale, who was the main medical officer over there, she helped us. And all the patients as well as all the ASHA workers, they were really happy because we distributed all the flip charts in the local language, and the videos were also wonderfully, and everybody listened to those videos, and we answered so many questions of the staff workers as well as the patients also. So these are the various photos which we had clicked. And in the first camp, as you can see that this is Dr. Arundhati who did the inauguration, and she also told all the ASHA workers that they should explain to each and every villager about all these awareness things. And the information about the flip charts was given to the health workers, and the inauguration was done. And the felicitation of government officer was done in the hands of Dr. Reshma Rajboi and Dr. Khandare. And these were the beautiful flip charts which we really distributed, and everybody was happy. I would like to tell you that we did this at Koregaon, and the second camp was done at Godoli PSC. And it was a Ganpati festival, yet there was a very good response from the ASHA workers, Anganwadi workers, and the patients too. And the program was appreciated by all. The idea of flip charts was appreciated by all health workers. And then we did the felicitation of Dr. Rasika Gokhale, who really helped us out. And my dear colleagues in the second camp, that is Dr. Vrunda, Dr. Reshma, then Dr. Aparna, and Dr. Smita Kasar, who really helped to make this camp very much successful. We felicitate all the government officials also, and all the snacks were also distributed to them, as well as tea and coffee was given to all the members or the attendees. So what was the highlights of the camp was that it was appreciated by all the different aspects about a woman, from menstrual hygiene, fertility myths, PCOS awareness, importance of breast and cervical cancer screening, and it was very well explained in one sitting. And all were happy about the flip charts. as even Rehman sir said, or everybody says that even if you find one case of cancer in screening, and if you can save her life, that is much more important for us, and it is really worthy to take such kind of camps. So I thank Dr. Talwar sir, Dr. Shweta Mittal madam, Dr. Gauri Devi, Dr. Sarabjit Singh, and of course the entire team for making these wonderful efforts to make this dream come true. So what are the inputs that, yes, we have to educate about the early detection, risk factors and preventive measures. Free or subsidized screening tests have to be done. We should have expert talks by oncologists, I think so. And even survivors, we should have some survivors who can share their stories to inspire awareness and action. In infertility, question and answer sessions, workshops on lifestyle, that is very much important, because even we get so much obese patients or persons in villages also nowadays, because there are so many cake shops and bakery shops are there. So you have to tell them about nutrition and stress management for reproductive health. Emotional well-being and mental health support discussions have to be there. So in the last, I'm really grateful to the team, wonderful team led by Dr. Pankaj Talwar sir, Dr. Shweta Mittal, and I thank from this land where Shivaji Maharaj was born and he ruled the empire, Maratha Empire from there. Thank you so much.
Thank you, ma'am. Now I hand over the mic to Dr. Siddharth, Secretary, Andhra Pradesh Chapter. Sir is there? Himanshu, Dr. Siddharth is there?
Yes, ma'am. Yeah.
Sir is there?
Thank you.
Yes, sir. Yes, sir. Himanshu, please unmute Dr. Siddharth.
Ma'am, Dr. Siddharth sir already co-host.
Yeah.
Okay. Right.
Yeah. Yeah. Actually, greetings from the Indian Fertility Society AP Andhra Pradesh chapter. So this project Sanjivini in the AP chapter was very meticulously organized by Dr. Sumavarsha and Dr. Anita. So I think better they will speak because they have done a lot of work. So it's not correct on my part to me speaking on their work. Actually, I request if the permission, the President and Secretary, let Dr. Sumavarsha speak. I think she should give the credit.
Good evening. I'm right here. So can you hear me?
Yes, you are audible.
I'm Dr. Suma Varsha. So good evening all. I firstly thank Dr. Pankaj Talwar sir, Dr. Shweta Mittal ma'am, Dr. Gauri Devi and Dr. Sarabjit Singh for giving us this wonderful opportunity. It was really great to interact to the public of the rural areas. And this idea of Sanjivini project was really appreciated by our district medical and health officer. So our first camp was conducted at PHC Ajit Singh Nagar. Dr. Anita and myself had attended that, and the health authority there was Dr. Yesubu. We educated almost 8 ANMs and 8 ASHA workers. We saw almost around 25-30 odd patients, and it was a very interactive session, and it was very enlightening to the public when we told them that you can actually prevent cancer right from its roots. We gave a lot of awareness about HPV vaccination. They were very inquisitive about it. A lot of patients came and asked us if they can come and get the vaccination done for their kids. We also educated them about self-breast examination. The flip cards were really appreciated by everybody, and actually our DMHO madam was actually asking us if we can actually have more flip charts distributed to the other PHCs as well, and we can do many more such programs. The second camp was conducted at PHC Kondapalli on the 26th of September 2024, and it was taken care of by Dr. Anita, Dr. Padmaja ma'am, and Dr. Vanilla. The health officer there was Dr. Padmavati. We educated around 8 ASHA workers. We saw around 15 to 20 patients, and we had a few patients who were counseled for fertility treatment as well. So both camps really took off really well, and our district medical and health officer personally actually called us and asked us if these initiatives can be done in more places, whether they could have distribution of these flip charts to more ASHA workers. She told us that there is a day where all the ASHA workers actually meet, and if on that day we are able to educate them, then it actually reaches out to many more people. So probably this is a very wonderful initiative which can be taken up forward, and it surely will make a huge difference in the community. So I thank Pankaj sir, Shweta ma'am, Gauri Devi ma'am, and Sarabjit Singh sir for their constant guidance and support. I also thank INTAS for being very prompt and helping us out. And this is surely breathtaking breakthrough program, and we were very happy to be a part of it. So thank you so much, everybody.
Thank you so much. Now I invite Dr. Akshay Kumar Mahapatra, Secretary Odisha Chapter. Sir is there?
No, ma'am, not joining.
Hello.
Sir is not joining?
I think Sujata is doing for them. Sujata,
Yes,
you
yes.
are there, no?
Yeah, I'm
Sujata
there.
will do in
Dr.
place of Akshay.
Dr.
Yes,
Sujata is
Sujata.
there? Yes, Dr. Sujata.
Yes, I'm
please.
there.
Over to you, Sujata.
Yeah.
Good evening, all. I'll be presenting the report on behalf of Odisha chapter. And the first camp we organized in the community health center Jatni, where we four of us attended and we addressed 25 health workers. We felicitated the CHC Joint Director, Dr. Jitendra, and that day there was some time issues because of the immunization day, Wednesday, but the camp was well organized and ends well. And the second camp we organized in a UG CHC Dumduma near Bhubaneswar, and two of us went there, and we addressed 15 health workers and 7 patients, and we explained all of them regarding the topics, the pre-decided topics like menstrual hygiene, infertility, PCOS, and breast cancer screening and cervical cancer screening, and the patients, there was nice inputs from all of them who attended the camp, and the flip charts in the local language were really appreciated by everyone. They were very happy, and all the health workers, they promised, they understood the subject well. They were very keen and interested to message, and they will help their patients and the neighborhood. But the problem with us was we faced difficulties conducting the camps because we to conduct camps in government hospitals, we have some restrictions in the state of Odisha, because it is difficult for us to get approval from government to easily to get both the camps. Dr. Akshay, the first camp and the second camp, we had the personal involvement, like personal relations with they were our friends, because of them that only we got the permission. Otherwise, to get official approval from government, it was difficult for us. That's why we could not gather many patients, and otherwise the crowd would have been a bit better. Thank you.
Thank you so much. Now we move on to phase 3. Dr. Chitra ma'am, Secretary, Pondicherry chapter.
Yeah. Good evening, all. Good evening, respected Pankaj sir, Shweta ma'am, and Sarab sir, and Gauri ma'am, for giving us the opportunity to connect this really a very good project within in Pondicherry. We had two camps. One was at the PSCs, Ramnathpuram, and the UHCs. The first camp was conducted on October 9th at Ramnathpuram. We had deliberations by all our respected faculty, Jayashri, Ambika, Saranya, and really gave a good talk on these subjects, and sometimes they accompanied too also. And there was interaction with the patients, the attenders who had come over there. A lot of healthcare workers also were very curious. The best part of everything was this flip cards. They were so happy, like what we told on that, it ends with that day, but what we gave behind with them was a flip card. They told this can be utilized for every time they visit, and they already plan to have at least once in a week awareness program in their PSC, so that they repeat what all we have told, and they're going to play this video continuously on the screen which they have it at their PSCs. So this is what the Ramnathpuram. We had Dr. Sunil, Dr. Pratima, and Dr. Subita, who really helped us a lot in connecting. This is our audit report of our first camp, which we had. We saw around more than 65 patients, and we already had some few nice discussions. And second camp was done at Urban Center, Kuchikupam, on 23rd of October. And here we had more patients. Because it's a USA, we thought not many, we won't have much of issues. But here the patients who had come really had a lot of lack of awareness of lot of infertility, and even the awareness of the carcinoma cervix or in the breast cancer. And they were very shocked. These all are quite preventable, and self-examination or doing a pap smear regularly can really help and alleviate these symptoms. And we had here doctors, three doctors, Dr. Devan and Dr. Mahalakshmi, with a few of the staff nurses. And here also, again, I'm telling you, the flip cards were well appreciated, and they wanted more, but we just told, okay, now you can utilize, because Asha care workers wanted to take few to their centers and start telling them at least once in a week. They had fixed the date of Saturdays. Both the centers, we felicitated the doctors who are really helped us, and we really provided the snacks. I really thank the INTAS for really, because sometimes when you get exhausted, and some patients, we give snacks or something, they quite deliberately sit and listen to the talks. So, and this is the audit report of the second camp. So I really like to thank the sir, madam, and the INTAS for really helping out to conduct this project. Thank you.
Thank you, madam. I now invite Dr. Rupashri, Secretary, Jharkhand Chapter. Madam is there? Himanshu, please check. Madam,
yes, I am there. Can you hear me?
Yes, ma'am, you are audible.
Okay. My greetings to all of you, and it was really an enriching experience for me to go through the great visionary of Dr. Gauri Prasad ma'am. And we get all the support and response from Dr. Sarabjit. So my sincere thanks to him. And above all, the able leadership of Dr. Pankaj Talwar sir, I would rather prefer to address him as a motivator, as a guardian of all IFS member, and dynamic icon, Dr. Shweta Mittal madam. Under phase 3, we have been assigned to do the camp. And first, we made awareness video, though it was in Hindi language. We could not make it in Jharkhandi language. But my thanks to entire team of Jharkhand chapter, like Dr. Pooja Rani, who make videos on PCOS, Dr. Soumya, who made videos on breast cancer, and Sumedha Gargi for making video on cervical cancer, and Dr. Ruhi for menstrual hygiene. So the first camp we did on the 9th of October, which was in Angada, which was approximately 15 to 20 kilometers from Ranchi main city. And it was really accepted and welcomed by MOC there, and we get all support from the medical personnel there. So it was really a great and wonderful experience to interact with all the patients, the sahiyas. And it was really, as a person, I enriched myself, because we provided them counseling, and we solved their queries. So, and the second camp which we did was on Gola, which is in Ramgarh district, approximately 50 kilometers from Ranchi. And there 35 Sahiya attended the camp, and to overall 60-70 beneficiaries were there. So one thing I really want to highlight about the flip charts, as every chapter secretary mentioned, really they were very happy about the flip charts, and they wanted to have more in the Hindi language so that they can create awareness among the patients. And the excitement and really the patient empowerment program cannot occur without the gross root level workers like Sahiyas, and this is the program where this happened in the real sense. And few inputs which I get, so we should do more camps. There were demands from the MOCs and medical persons that if we could provide a monthly camp for each one of them. So thank you so much. And I know with the great flag bearers, we will in the near future, whatever loopholes I got, like we cannot provide them the basic investigations. In near future, we'll try to overcome that. So thank you so much, IFS team, for providing me this opportunity and making me part of this wonderful program, and Intas Pharma for well-coordinated program. Thank you so much.
Thank you, ma'am. Next is Chhattisgarh chapter. I now invite Dr. Anuradha, madam. Dr. Anuradha is there. Dr. Anuradha, Himanshu, please check.
Ma'am, she is there, but she's not unmute themselves.
Actually, we are running 3 minutes early. I think she must be waiting. Should I call her?
Good evening, each and everyone. Hello.
Yes. Hello, ma'am. You are audible. Please, ma'am, continue.
Yeah, ma'am. Good evening, each and everyone. And we all know this project Sanjivani was very wonderful, very novel and unique idea of our team leader, Dr. Pankaj Talwar sir and Shweta Mittal ma'am. And first of all, I thanks and also congratulate to Dr. Pankaj Talwar sir and Shweta Mittal ma'am and all team members like Gauri ma'am and Sarabjit sir, who has taken such a wonderful ideas and pain to get it successful. That is very important, to have this idea also to serve the poor people who could not who don't know about all these things, how to take care and all, along with these ASA workers and Mitanin. And to be frank, it was really very wonderful and very successful also. In all the what I heard from all the chapter secretaries and everyone, it was very successful. In my side also, in Chhattisgarh also, it was very successful. Though first camp I was planning to do at Kanker, but I could not get the permission from CMHO because of some problem within 2-3 days. But second camp I have organized on 13th of November. There I called the CMHO sir, nursing home people, other doctors also are involved, and that is at Birgaon on 13th November, and it was of 6 hours camp. I have seen around 48 patients with 20 health workers, and most important part of this is the Flipkart, where the health workers, they got the knowledge, and the part was discussion, question answer session. They got happy about getting this Flipkart also, and whatever queries they have in their brain, it has cleared. So I, without wasting time, I just give 1 or 2 lines about this Sanjivani program. Really, it was very good, but we need to do frequent camps to help the poor people to reach the doorstep and have the like prior information along with the CMHO and district hospital in charge or PSC level or CSC level, along their permission from before only, so that we will gather more people, more poorer people, and we should get only one educating this Mitanin, ASA workers and all, specific for them for education. We should keep camps like weekly or 15 days in that. So if we will teach them, give the education indirectly, as they are very close to this poor people, we can help directly to this poor people, as they don't have any idea about this, what are the treatment available, how they will take care of the best, how they will be screened by the for the cancer. And PCOS patients, they all got happy, and they will get the service. And thank you for this opportunity. I thanks Dr. Pankaj sir, Dr. Sweta Mittal ma'am, Gauri Devi ma'am, Sarabjit sir, and all the team members, along with the INTAS people who has helped to this organize to this camp, all these camps. Thank you again. Thank you so much.
Thank you so much, ma'am.
Thank you.
Sir, Dr. Kalpana Singh, she has not yet joined from Bihar chapter.
You could give her a call. I think she's with the, I think, CM of here to address a meeting with them. Give her a call in case anybody else from
Sir, I have
Patna or
asked
Bihar.
Farah to call
Anybody?
Dr. Kalpana.
Just okay, in case she's not there, I think so. I think they've done a great job, and we have all seen all of them working so hard. I think we can, if nobody else is left, we can then, I think we can sum it up. And
Yes, sir.
Dr. Gauri ma'am is there, Dr. Gauri ma'am, and Sarabjit. Gauri ma'am, would like to hear from you. Have seen what all has happened under your tutelage and how things have progressed. So we like to you to you're so senior, but just summarize everything, ma'am. You and Sarabjit.
Right at the beginning, I said no, that the chapter secretaries and all their workers, they've done a tremendous
Yes,
job
madam.
getting the
Yes,
whole.
madam.
I was just wondering, how many flip charts was given to each chapter secretary? Any idea, Sarabjit?
Madam, 900, madam. 900 is the number.
So even if they distribute one each to each of the this thing, there should be some more left, or no? We have to get the more printed.
Ma'am, the thing is, because they were of different this thing, so
Yes.
everybody was like initially everybody took 2 or 3 the checked with the ASHA workers. क्योंकि
Okay.
अलग-अलग topics थे, so that was is why we were
So we are left with no flip charts.
we are left with, we might be having, but it won't be substantial actually.
Okay.
Might be having few, but won't be substantial.
Only silver lining in this thing is that Mr. Satpathy saying that this is not the end of it, and they are trying to help us out in having more of the camps. So let's wait and see. He says it's a lull in the storm for about 2-3 months or 4 months. So let's wait and see if it will materialize, because obviously from what all our route workers are saying, that it was a very successful program, and more and more people wanted to get involved. So let us hope, God willing, we will be able to continue this for another year. And I can't thank enough.
Ma'am, we will continue this program for sure. Satpati.
Oh, thank you. Thank you. That
So just
that is
give me
really-
time till end of this financial year. Probably I have been in touch with the CRM and the finance department continuously.
Okay.
So we'll sort out a way. The
Okay.
only issue I'm finding is the execution at the ground level.
Okay.
Those expenses. So let's see, like maybe we can give it to the local society to organize everything, and the funding is done through IFS. Something like that we'll do. We'll plan it out.
Or is it possible that you give to the IFS? IFS can give it to
That's what I'm
the
telling. That's what I'm
chapter.
telling.
I
That's
don't
what
know if that is possible. And the chapter secretary, it may be easy for him to give that to the person who goes there. I don't know if it will work.
Yeah, see, they can locally, like, arrange for see, this is basically arranging some snacks and arranging a audio visual.
Yeah, that's
That's
it.
all. So
Yes, good thing.
it costs you not more than 5,000-10,000 rupees, 15,000 rupees.
That's true. That's true.
So, but for my person, all this program, I'll have to send a person to the place, because nobody gives you credit because we don't have vendors. So he need to go pay cash, and then when he submits the bill, he has paid it from his out of pocket expense advance, but he has submitted bill of 500 samosas been purchased. then the audit says, what did you do with those 500 samosas?
Yeah, that's true. That's
हमें भी मिलना चाहिए ना मैम समोसा एक. We never got that samosa.
सर
सतपति जी, we never got that samosa.
समोसा में तो नहीं चलेगा सर,
कभी
आपको
नहीं
देना
मिला आपको
पड़ेगा.
समोसा. हम खिलाएंगे आपको. Thank you so much. I think, ma'am, before we end up, if you permit me, I like to invite two more pillars of who have actually seen it through. I'm looking for Shalini.
Shalini and Rashmi.
Shalini and
They have
Rashmi.
done a tremendous
We'd
job.
like to hear from you because you have created in history.
Yeah, true.
We are loading around one video per day, ma'am.
Yeah.
YouTube channel. Now also we are Facebook and YouTube live. And this couldn't have happened without our web team.
Yes, it would be.
Shalini has done a super job and Rashmi has been guiding us all the time. She's not there. So guys, before we sign off, we must go to our YouTube channel. We have got scanner codes for every language: Bhojpuri, Marathi, Kannada, Tamil, Telugu, Marathi. Not Anjali shaking her head. Anjali, madam, thank you so much. You know how challenging it was, but with the help of Intas team, we have done it. I feel so proud from Kashmiri to Bhojpuri we are there. And I think now it's a matter of jab bhi hoga, samay acha aayega, so we can do it. But I think we must celebrate each other. It's a big victory for all of us. And as we celebrate the victory, I request all of you to put on the cameras. For 30-40 seconds, please put the cameras on. And now I'll invite our Sher Punjab, Sarabpreet, Sarabjeet, for a song. Sarabjeet, एक गाना हो जाए तेरा यार.
हाँ, ये तो
छोटा सा गाना
बिना
क्या
उसका क्लोजर हो ही नहीं सकता है.
हाँ, एक तो गाना हो जाए. तुम लोग कैमरा ऑन कर लो. बच्चों लोगों ने बहुत अच्छा काम किया. आपने बहुत अच्छा काम किया एंड यू हैव डन अस ऑल प्राउड. निताशा, सुरजीत मैडम, हितेंद्र, प्रिया, संभाजी, रहमान, अंजलि, चित्रा, सुजाता, रूपाश्री, अनुराधा, all of you. Geeta Khanna madam, please put the camera on. I'd like to say hello to you. And all the team members, we are so proud of you. And we'll end up with a song from
But
Sarabjit.
more than anything else, no, Mr. Satpathy, you have seen how all the chapter secretaries and all the workers at the grassroots, how they were appreciating your videos and flip charts.
Thank you so much.
Really an achievement, really.
I think all credit goes to my colleagues Sanjeev and Ankita who have done it.
All of them. Since you are representing,
they've done a good job.
Yeah, they have done a good job. You should extend our, extreme gratitude to all of them.
Thank you.
We are part of IFS, ma'am. You don't have to thank us every time.
Thank you, sir. Thank you. So, Sarabjit, over to you.
Yes,
And
sir,
thank you
always
so
there,
much,
sir.
guys. हम सबके नाम नहीं ले पा रहे हैं यहाँ पर. मानव जी, नेहा, सुहास पाटिल, रेणुका, फातिमा, all of you, Vrinda, thank you so much. Over to you, to the Khalsa team.
जी जी. तो सर ये प्रोग्राम बेसिकली is something that actually we as a doctor are supposed to do. We obviously have an obligation towards our society also. और जैसे मैं कहता हूँ कि यही चीज जो है ये निशानी छोड़ जाती है. तो वही निशानी के ऊपर ही 4 लाइनें मैं जो गा रहा हूँ तो वो है, एक दिन बिक जाएगा माटी के मोल, जग में रह जाएंगे प्यारे अनमोल, दूजे होठों को देकर अपने गीत कोई निशानी छोड़ फिर दुनिया से डोल. एक दिन बिक जाएगा माटी के मोल, जग में रह जाएंगे प्यारे देश मोल. तो all these flip cards, all these videos, they'll remain there. And यही आपकी निशानी छोड़ के जाएंगे. Thank you
They're
everyone.
all on our YouTube.
Thank you very much.
All our YouTube channel, everything is there. All created. Go to website.
Yes.
Shalini is not there. A website has got all downloadable format for
Sir,
everyone.
I'm there.
Shalini, बताना यार कहाँ है? कैमरा ऑन कर, ऑफ कर, ऑन कर और बता क्या क्या काम किया है तुमने. इतना बड़ा काम किया है तुमने और तुम दिख ही नहीं रही है और ना रश्मि मैडम दिख रही है.
सर मैं पूरा टाइम मीटिंग में थी, बस 2 मिनट अभी मेरा डिस्चार्ज हुआ फोन, तो वो करना पड़ा.
बताओ क्या क्या किया तुमने.
Yes, so we have everything on the website and there are QR codes created for all the programs, the national programs, and you just click it and you're able to see the entire programs on the website. In fact, we have put it the state wise, the QR codes are there. Like For Vidarbha chapter, there is there the Marathi, the Jammu language, all language, they all are there. So it's just a click there. All the flip charts in all the regional languages, in fact, they are also being put up there.
So thank you so much. And
Yes,
with
sir,
this,
yes, sir.
thank you so much, Shalini. So I
Thank you,
think
sir.
there is our Honorary Secretary General,
And
Madam.
in fact, if Dr. Rashmi is not there, then even in the YouTube channel of IFS also, we have all the videos being put up there in all the regional languages. And we have QR codes for the YouTube channel also.
कहते हैं ना, जब शुरू किया था हमने, वी हैड एक्चुअली नॉन एग्जिस्टेंट यूट्यूब चैनल. हमने बहुत दिमाग लगाया. एक छोटी सी कहानी सुनाता हूँ. एक पोएम है दुष्यंत की. दुष्यंत इज ए वेरी फेवरेट पोएट ऑफ माइन. ही सेज 2-3 लाइंस. वो कहता है कि कौन कहता है आसमां में सुराख नहीं होता. कौन कहता है आसमां में सुराख नहीं होता. एक पत्थर जरा जोर से उछालो यारो. एंड वी हैव डन इट. वी हैव broken the sound barrier. 30 camps, pan India, 12 languages, 900 flip charts circulated in 12 languages, 60 videos in 5 languages. I think only IFS could do it. Thank you so much, guys. And Shweta and Yogita, over to you.
Before concluding, can I say one thing?
आपके बिना क्या हो सकता है? शेर कश्मीर हमारे.
Before concluding, I thank 2 gynecologists, Dr. Fatima Nisa and Dr. Zohra Gulzar, who have connected with us from Kargil, Leh Ladakh. So I'm very thankful to both of those because they were all the time today.
Are they there?
Yeah. Fatima Nisa is there. Zohra Gulzar
please put the cameras on.
Yeah, Fatima Nisa. Yeah, but she left.
Camera on, KJ, please. We like to felicitate you. Thank you.
Yeah, Fatima is here. Fatima Nisa.
She's Veronica, I'm seeing Veronica, Neha, Suhas, Renuka.
She was there. Maybe she left because of that.
So she's there.
No, she's there. She's there.
Sir, can I take your leave? I'm in a meeting, so.
Yes, sir. एक बार finally श्वेता मैडम का बाय बाय सुन लें एक बार मैडम का. उसके बाद आप निकल जाइएगा. बस 1 मिनट.
श्वेता मैडम का अलग से फोन में सुन लूंगा.
ओके, चलो जी, चलो. धन्यवाद.
नहीं, बोलिए मैडम.
मैम नाराज हो जाएंगी.
अरे आप बोल दीजिए.
I think we need to have a sweet ending पर डॉक्टर सरबजीत ने already कर दी with the sweet song. And there will be a long list of thank yous what we will be hearing right now. I think the biggest initiative is from Dr. Pankaj sir. Couldn't have been executed without Mr. Satpathy from INTAS because this help was much needed from them. Our national advisor for this program, Dr. Gauri Devi ma'am, and who's so ardently firm. I could see that all through the program, and our national coordinator, Dr. Sarabjit, who actually got the whole execution done all across India. Then all the chapter secretaries and their team members who were involved in it. I think all the Anganwadi workers, all the patients, all those who attended were a part of this program. All the coordinators, and if I have missed any names, all of them. So thank you so much. This was a wonderful program, getting a whole catch up from everyone, their bit of, hard work, which we could see today all together in one big capsule. So we hope and we are wishing that Mr. Satpathy will again, I think raise his magic wand and we can restart this program. And I think phase 2, if it starts, I'm sure it's going to be at a bigger magnitude and a more wider population whom we will be able to cover. So I think we can sum up, sir, now.
Yeah, Yogita can.
You did not announce that the phase 2 would start after you give a party to everyone in this meeting?
Samosa.
I will.
Samosa. मिर्ची की चटनी के साथ में. Thank you so much.
पंकज सर देंगे कि श्वेता मैडम देंगे? कौन देगा पार्टी?
सर पार्टी तो हमारी सेक्रेटरी जनरल देंगे ना.
पार्टी लॉन्च करना पड़ेगा ना.
Allotted funds allotted.
इसको लॉन्च करने के लिए मीटिंग करना पड़ेगा ना.
हो जाए.
Thank you very much for wonderful meeting, sir.
Fatima, welcome Fatima. How are you?
Yes, sir.
Sir, I'll take your leave now. Bye.
Thank you very much.
Bye.
Thank you, Fatima ji.
Thank you, sir ji.
Yogita, goodbye from your side. Goodbye from your side, beta.
Sir,
Yes, sir.
sir, I'm leaving the meeting.
Bye, sir.
Bye, Mr.
Bye, sir. Bye,
Satyajit.
sir.
Bye.
Bye, sir.
Bye,
योगिता
bye, bye.
बाय बाय बोल दो
हाँ जी सर,
फॉर्मली
हाँ
बाय
जी,
बाय
हाँ जी
बोल दो
सर। मैं लास्ट में 2 लाइन्स में थैंक यू बोल देती हूँ सर। ऑन बिहाफ ऑफ एवरीवन प्रेजेंट, आई एक्सटेंड माय हार्टफelt gratitude to our esteemed speakers, dignitaries for sharing their valuable insights. Sincere thanks to the participants also for making this program a resounding success. We deeply appreciate your time and effort. Looking forward to more such programs in the future. Thank you once again. Thank you, sir. Thank you, ma'am. Thank you.
जय हिंद थैंक यू
Yeah,
Okay.
Jai Hind.
थैंक यू
Thank
गौरी
you,
मैम
sir.
थैंक यू
Thank
श्वेता मैम थैंक यू सर एवरीवन बाय 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 बाय
Thank you, sir.
Bye, bye.
Bye.